The Akwa Ibom State Ministry of Health, in collaboration with the Breakthrough Action Nigeria, has organized a sensitization program for residents of Mbiabong etoi in Uyo, the state capital, ahead of the 2024 World Tuberculosis Day. The event, which was held at the Primary Health Center in the area, also featured free TB testing, particularly for participants with cough that has lasted for up to 2 weeks. ADBN correspondent Akwa Ibom completes the report.
Tuberculosis remains one of the top infectious killers worldwide, despite significant progress in diagnosis and treatment. According to the World Health Organization (WHO), over 10 million people fell ill with TB in the last 2 years. To necessitate the prevention and further spread of the disease, health partners in Uyo, the Akwa Ibom state capital, have come together to raise awareness about tuberculosis that still affects millions of people globally. Reeling out the challenges associated with TB to include drug resistance, inadequate access to healthcare services, stigmatization, and lack of awareness, the Assistant State Coordinator TB Project for Breakthrough Action Nigeria, Dr. Uwem Ofon, explained that these factors contribute to the continued spread of the disease and hinder efforts to control it effectively.
Thing that seems to be a challenge on mitigation of TB is just adherence. We've done a whole lot of community sensitization, media advocacy, and we've realized that many people have this knowledge about TB, although a lot of them still stigmatize people with TB. So I can say that adherence and stigmatization are the major issues that prevent the mitigation of TB.
He added that community engagement is crucial in the fight against TB by raising awareness, dispelling myths, and promoting early detection and treatment-seeking behavior. Communities can play a significant role in reducing the burden of TB and supporting those affected by the disease. On his part, Team Supervisor for Tuberculosis Program in Uyo, Mr. Ifyok John Umor, said prevention and control of TB require a multifaceted approach that includes early detection through screening and testing, prompt treatment with appropriate medications, ensuring access to quality healthcare services, as well as the importance of contact tracing for infected persons.
Mothers, too, who are having children, because when we talk about TB, they really look at the adults. If you're having a child who is not growing the way it should grow, who has all the signs and symptoms of TB, who coughs for more than 2 weeks and is losing weight and is having night sweats, please, that child should be investigated for TB. And where we have children coming down for TB, we need to do what we call contact tracing, because through contact tracing, we will know other persons who are having TB in that household. So if all these have been put in place, plus the chemotherapy, giving out the drugs, the burden of TB will really reduce in Nigeria.
He therefore reaffirmed the ministry's commitment to ending TB in the state, stressing that every action against tuberculosis counts. Aweru Swogene Ebo for ADBN TV.